Hello, this is Dr. Gay from First Look MRI, and this is a 25-year-old female who exercises a lot at the gym, and she has new onset of pain in her forefoot. And we see a marker here in the area of pain. Deep to that, we see the third metatarsal bone. That looks completely normal. Marrow is very bright on this, and there's no abnormality. This is her third toe. But if we go medial towards the second metatarsal, we see the problem. Rather than a nice bright band of marrow signal here, we see a dark band. So this is replacement of the normal fatty marrow with edema and healing factors, and this is a stress fracture. And if we go to a different view, let's look on the coronal view. This will show up a little bit better. On this view, we see the great toe here. We see the first metatarsal bone looking normal. We see the second metatarsal bone low in signal. So that's that metatarsal stress fracture. And here's the third, fourth looking good. So there's where it is. Now we have other sequences where we can take the fat and suppress the fat, and marrow edema or fluid will stand out as bright. So let's put up one of those views. And on this, you can really see the fracture well. So this is, again, a stress fracture, not a displaced fracture. The cortex, the black line, is intact, but there's microfracture, injury, and this will go on to be a displaced fracture if the patient doesn't stop what they're doing. And we also see a little gray band over the surface of the cortex. That's some periosteal new bone formation trying to heal this, strengthen it, and lots of white, which is edema in the deep surrounding soft tissues. So a very prominent, we call this a severe metatarsal stress fracture, and there's that little transverse band of low signal where it's trying to heal. Now here's another plane to see this. This is the marker, and deep to the marker we see the normal third and the abnormal second metatarsal bones. There's the dark band is the cortex. It looks a little thick as compared to this where it's nice and thin, and the marrow, instead of being bright, is low in signal. And we can put up this view. It'll really show up good here. This is a short axis view where marrow is normally dark, but if there's a marrow injury, it's light bulb bright. So obvious fracture there, metatarsal stress fracture, and you can see that halo of of soft tissue edema, and then this little gray rind of periosteal new bone formation. So a 25-year-old female with a second metatarsal stress fracture, severe stress fracture, but at this time no bone displacement. Thank you very much.